I see a lot of gestational diabetes so common now. Being an Indian woman, you're pregnant. Previously, it was like if you're a high-risk person, you are supposed to get screened. Now, being from the Indian ethnicity, you are a high risk and you have to be screened.
See, childbirth as such is a very, very holistic phase of your life. It's more to do with emotions, not just evidence.
What is your personal preference, hospital birthing or home birthing?
I would always go for collaborative model of care.
What are the top 3 myths about breastfeeding you wish every Indian family unlearned?
Wish I could go for an entire episode about this, but I'm just going to limit myself. The first one, you don't.
Welcome to Feminine Systems by Dr. D, the podcast which not only heals and empowers women, but also reimagines systems around her. I'm Dr. D, an integrative gynecologist, an author, and an entrepreneur. Today's guest for the podcast is an interesting speaker. Miss Haritha is a maternal and wellness expert with more than 7 years of experience supporting women from preconception to postpartum. Inspired by her own VBAC journey, she founded Paavai, a space where tradition meets science and care extends beyond clinical support. As a certified birth educator, doula, a lactation counselor, relationship coach, and BCST practitioner, Haritha offers an emotional and physical guidance to families through birth and bonding. I'm so glad and happy to welcome Ms. Haritha to Feminine Systems podcast today. Welcome, Haritha. Haritha, I'll go to the question straight. Some pregnant women say, I'll go with the flow. I don't need a childbirth class. What would you say to them about this intentional preparations and childbirth classes?
See, childbirth as such is a very, very holistic phase of your life, and it needs a 360-degree approach. It's just not about the exercises, not just about the evidence, but it goes beyond that to see as a person who you are, how your belief systems have been. And it's a phase where they need a lot of, space and holding for them to be their truest self. So it's more to do with emotions, not just evidence. So when they come to class, they get this, emotional support with the birth educator. They get to have peer support with other mamas who go through the same preparation. They have the information that they need for the birth, and they feel that they are in a community. And for humans, it's always about being in a community, right?
Man is a social being.
Yeah, man is a social being. So I think that's something that they might miss on.
Okay, interesting. What is the difference between a doula and a midwife?
A midwife is a professional who does natural births, or rather I would call her a natural birthing expert. Whereas a doula is a professional who has the evidence-based information about the physiological process of birthing and who also addresses the emotional aspects of the family. When I say family, the father and the mother. She is there with them during the prenatal period to address your, emotional needs, to support them to make choices or birth preferences. And she, goes along with the birthing families to the hospital while they labor and give birth, and provides the physical comfort through massages, through different movements. And she affirms the family that, they are in this together, they are strong, that kind of moral support is always there. And she stays by the birthing family 24/7 till they give birth. And I say 24/7, okay. It doesn't mean they're going to go, that long. But what I mean to say is, even if it's days together, she doesn't leave the mother. She's there to hydrate the mother. She's there to take the mother for the washroom breaks. She's there to feed the mother. She's there to say, look into the mother's eyes and say, hey, you know what? You've got this. So that kind of emotional support, and also, helping her do all the physical movements that will help facilitate the birth. Optimal, positions for the baby to descend down and for the births to happen is also covered by a doula.
All right. How common people opt for these services, and how is midwifery perceived in India according to you?
The perception of midwifery is limited, I would say. Unlike the other countries abroad, it's not quite prevalent here. Here we are looking at a collaborative model of care where the midwife works hand in hand with the OBGYN so that they are able to give, the respectful and better outcomes for the birthing families. So there are quite a few birthing families who would opt for, birthing centers, but the number is less. Our population majorly gives birth in hospital setup. Even though there is awareness, there are not a lot of takers because the strength of midwife is very low here in India.
Okay, the number of midwives.
Yeah.
And there are, I think, hardly 1 or 2 midwife-led birthing centers.
Yeah, we do have 2 midwifery-led birthing centers. And we have foreign midwives who are practicing here with other OBGYNs also. So that's also there.
What is your personal preference? Hospital birthing or home birthing or birthing center birthing led by a midwife?
I would always go for collaborative model of care. I want the natural birthing expert and I also want the, surgical expertise of a OBGYN as well. So that,
surgical and medical, basically
clinical
expertise, right? Okay. So
midwives are also clinically, experts to do the natural birthing process. But when you need higher amount of interventions, when the pregnancy is a high risk pregnancy, that's when we really, really need the doctors also in the play. We can't, kind of discount their role. So it's always collaborative model of care. Both of them go hand in hand.
Got it. So if you would like to position yourself as a midwife or a doula or a lactational consultant, if you have to choose among the 3, how do you position yourself?
Doula.
Okay. So can you say what is the difference between a nurse and a doctor with a doula?
A nurse again is a professional who has the clinical expertise. She does all the medical tasks that have been assigned to her for the birthing mother. But a doula does not do any clinical tasks. She is pure and purely there for the mother and the father to support them in their laboring and birthing journey. So she does not perform clinical tasks like, reading your BP, reading the baby's heart rate, putting the IV or anything like that.
Even the pelvic examination and decision making is not the part of it.
Right. We just address the physiological aspect. We don't look into the clinical aspect.
And the psychological aspect also.
Yeah,
right?
Psychological and physiological.
Very.
So that counts for movements, that counts for, the verbal affirmation, that counts for the rapport that we build throughout the prenatal period. All those things will come under our expertise.
I know. It's a moral support which is very, very essential during a time like labor and delivery. How do you handle hospital environments which actually dismiss a doula service and put it as optional? We don't require this.
The honest truth is that majorly it is like that.
Yeah.
Because the awareness, even with the birthing family, is less. So there are only few birthing families who feel, no, I need a doula. So they are the ones to opt for the support. So when they opt for the support, I leave the decision to them to go and talk to their doctor. So I don't go there to the hospital convincing or selling myself as a doula. So the onus is on the birthing family to say that, hey, you know what, I really genuinely feel that I need my doula with me and that will help me really have a better birthing experience. So they go and talk to the hospitals.
Got it. So, here, how do you make them get convinced or justified to the added cost of hiring a doula? Because a delivery per se, the doctors are also criticized sometimes. People are going into cesarean sections because they make more profit and not a normal delivery. There is a huge cost burden for a delivery and then after the child is born as well. So how do you justify as a pregnant family, right? How am I getting convinced to opt for a doula?
So it's a very, very tricky question because generally, as I told you, I don't convince them, but I stand for the values that I hold as a doula. So what I can offer them is the support that no clinician can offer. Clinical people, they take shifts. They do the, very, very important part of, understanding the clinical aspects so that the birth outcomes are
optimized.
Optimized.
Yeah.
But here as doula, we don't have that clinical part. So we have the, bandwidth and the space to hold the mother in whatever frame they are. So when we say that there is a doula present, it doesn't mean it's just going to be a natural birth. Doesn't mean it's going to be just a cesarean section. Doesn't mean that when there is a doula, she's not supposed to take epidural. Doulas are present to support the mother in whatever choice she wants to make. We are there for cesarean births. We are there for natural births. We are there for vaginal births with interventions involved. What does the mother and the father get out of it? They feel seen, heard, and held in that space.
Got it. Yeah, because frankly, an OBGYN, or especially an obstetrician, the doctor who delivers babies, are time pressed. So you kind of come in between to really save time for the doctor as well, allow them to do what they are best at, give them the space to actually, focus on the more important aspects, and you cater to a very important, time-consuming, emotional space. Very interesting.
I would also like to add one more point here, just to quote an analogy. Say there's a child who's crying. Okay, the child falls down, the child gets hurt, and the child is crying. When the mama comes and hugs, how does the child feel?
Yeah, it matters a lot, because my whole concept of feminine systems is to integrate care. That is very, very important, as good as medical therapy or prescription, I would say.
So that's the kind of calming and soothing effect that we have on the birthing families. The labor surges are challenging.
I know.
But they do not suffer in this process, because there's one person who's there to, hold them in that most vulnerable moment and say, you've got this. We are there for you.
All right. What is the science behind breathing in labor? Or how does it affect the uterus, cervix, hormones?
This might seem like a strong statement, but I think I should tell it at this point of time. So what I tell to all my laboring mamas is that, you know what? People can ask your partner to stay away, move out of the room. People can ask you to, be on the bed, not mobilize. People can actually restrict your diet, saying that you're just limited to fluids. But one thing, one powerful tool that they can never rob away from you is your breath. That's the power of breath.
Correct. Yeah, very true.
So when they are breathing, what they are signaling to their body is to stay in the parasympathetic mode, sorry. So the body is signaled to stay in the rest and digest parasympathetic mode. So they feel calm and composed. They are not in that hypervigilant, panicky state. And when they are calm itself, our body is able to do things in a better way.
Correct.
Yeah. They're not in this fight or flight mode, or they're not in the survival mode. Yeah.
Correct.
And when they are breathing, they are providing the oxygen boost to the whole body. And that includes the uterus and the baby as well. So the uterus gets the oxygen boost, and uterus does whatever it has to do in terms of labor surges. And the same boost is provided to the baby. So the baby's, heart rate is being maintained with this oxygen boost that is being supplied to the baby as well. And when you are breathing, you're also distracting yourself from this labor surge. And
Correct.
What happens in a labor surge? It's the tightening that you feel. It's the lactic acid buildup that you perceive as a discomfort. When you are giving this oxygen boost, your muscles are able to tolerate the surges better.
So it helps in pain management as well,
It helps
right?
in managing the labor surge.
Okay.
I usually don't say the word pain, because we have this negative association towards pain where we want to just run away from it.
Yeah.
But we need to make friends with labor surges.
Because I think if the men watching here, for their information, labor pain is as severe as a renal colic or renal stone pain or dental caries, a tooth extraction pain. It's so painful. It's equivalent to those very severe pains, right? So sometimes women go through it without pain medication as well. So do you have any tools and rituals that you offer for managing the labor surge, what you call it as, rather than to cope up the pain, what actually a labor goes through?
What I might say might sound very simple. The first point that I would really recommend is to sign up for a birth class with a proper educator.
Okay.
Okay. So that you get to understand what labor and birthing is about, and what choices do you have, and how you can manage your surges.
So preparation is the key.
Preparation. First is birth preparation. The second one is to choose a setting that is respectful of your choices. Okay, because when we say the perception of discomfort in labor is just not physical, it's also mental. When we have people with whom we are not comfortable, that in turn can increase, the perception of discomfort for us, make you alert, anxious, and that will disturb the labor process. So when the, birth preparation classes are done, you have the information to look or seek out for the right kind of care provider and birth setting. So that is addressed. So it's like your 50% of work is done. Then, not just the mother, I would like the whole family to be aware about birth. We have all so used to the mainstream, media, that we think birth inherently is risky and suffering and, lot of
scary
screaming.
Scary.
But when the whole family understands the physiology behind it, the experts who are supporting, they're able to stay in a calm mode. When the family, when the environment is calm, the mother is able to stay calm. That in turn will reduce the perception of the discomfort during labor. The other thing is that we also support with different simple tools that can help manage, which is like the sensorial stimulation that we teach about. What they can do in terms of massages, in terms of movements, that can help manage the labor surges or the perception of discomfort. And when all these things are done, we also bring the doula into the picture. Yeah, who stays there with the mama to do all the massages every time she has the surge. And that in turn can help her manage very well. And for all these things, I have a small vision of, setting up the birth preference. So you have a clear idea what I am looking forward to, what are my preferences are. So when this is done, you work on A, B, C, D, E, and you are well equipped. So I would say 80% is covered. The rest 20% depends on what happens in the labor.
Right. So, can you tell me what percentage of women whom you have serviced as a doula has not opted for epidural or other pain injections during labor?
I don't have the exact number, but what I can give you as a rough percentage is less than 10%.
Opt for
epidural.
Okay. So, any simple hack or a tip which you can tell us, this will help cope up with real labor pain during labor?
You know what? I would just like to quote a real life example. So we had a second-time mama. So she wanted a birth which is as natural as possible because her first experience and something in between after the first birth didn't really go well. So she was very keen on having something that is very low intervention. So I worked with her as a doula, and I also gave her biodynamic craniosacral therapy sessions. She went into labor, and I accompanied her to the hospital setting where she had signed up for. And she wanted to go to the washroom for whatever reasons, and we went there, and sitting on the commode, she's like, Haritha, pesama epidural எடுத்துக்கலாமா? What I'm trying to say is, I think it's better that we take an epidural. So just look into her and say, okay, so-and-so person. Okay, X. I understand that you are looking to take an epidural, but this is something that you wanted. This is your preference. Remember that we discussed about all these things. So let's just wait. Let's wait for the doctor to come and see you, and then we can make a choice of whatever you want. Okay. So the bathroom trip finished, and we, came back to the room. The doctor came, checked, and she was fully dilated. Okay. Sometimes it's just at the throes of labor, mamas can say things that they really don't mean. So again, the work of the doula is to, reiterate what they wanted and hold space for her to, this is what you wanted, but let me know what you're thinking for.
Yeah. It is a very critical juncture where somebody, reminds you of what was your preference and helps you endure it in a more comfortable way, right? Sometimes else it's frustrating.
Yeah.
When there is nobody to reassure you, sometimes it is very frustrating.
So, there have also been instances where I've told the laboring mother, kept asking me, when is the baby going to come? When is the baby going to come? I would not give a concrete answer because I don't know. I really don't know. But I would say, hey, let's do this. Let's go for a walk and then talk about it. Let's go for this, do this and come. Let's drink a hot chocolate and then talk about it.
Okay. Yeah.
Diverting her from that keen question is also something that helps some mothers cope up.
True. It's a real birth companionship, right? So we often dismissed. And you did mention about this biodynamic craniosacral therapy. Could you tell us more about it?
So it's a holistic therapy. It's a gentle touch-based format of modality that works on facilitating the health and healing of the body's system. See, every body has this innate wisdom of health and healing present in it. Let me give you an example. You get a cut, it heals, right? You catch a cold, the flu subsides sometimes, right? So there is always that innate wisdom or mechanism that is present in the body to heal. So this therapy is all about facilitating the health and healing present in the body by gentle touches.
Okay. So can anybody take it, or is it any other indications specifically which will actually make the recovery more effective?
Anybody can take it.
Okay.
Right from a newborn to people who are in the palliative care, anybody can take it because we are working with the health in the system. So this therapy is not about diagnosing, nor probing, nor setting intentions saying that, hey, you know what, I'm going to cure this for you. This is about listening to the innate wisdom of health that is present in your body, and that, innate system present within you will facilitate the healing and health of your system. So it works for anything. Say, for example, you are sleepless, you're very stressed, there are aches and pains, you're anxious, you've got certain health conditions, it can support along with other modalities of medicine as well.
Okay. So you emphasize on connecting to your own self and healing by the innate body's mechanisms, right?
As therapists,
rather than give any external, okay, no machines and equipment are used.
Nothing like this.
Okay.
When you come to me, it is this simple touch that is involved.
Okay. Nice. Interesting.
Basically listening to the body.
Okay. So, Haritha, can you describe the care pathway when I am a pregnant mom who comes to you? How do I enroll? How many months I have to invest, and how do you support that journey?
The first thing we do is talk.
Okay.
It all begins with talking to understand what the mother wants, where is she from, what are her preferences, where is she looking to birth. All those information needs to be discussed. So, which starts with talking. Then we sit with the mother to understand what part is she looking to be supported by us. Is it birth education? Is it doula? Is it lactation part? Is it BCST? Or is it the relationship dynamics in the pregnancy? So then I sit with her and I give her the suggestions. So when she comes to me around, say, for example, 2 months of pregnancy, I talk to her. I usually wait till they complete the NT scan, because that's when the mamas are quite settled without the nausea and, the
Correct.
tension about, how the baby is and all that.
Yeah.
After that, when that is done, we slowly start with the prenatal education, where we talk about, the nutrition for a pregnant mama, the care involved during the prenatal period. And then we, go on to discuss about the labor and birthing choices, the coping techniques, the informed decision making, where we talk about, what is present in the current setting, pros, cons, how does she make a decision? Okay, so informed choice. We talk about postpartum and infant care. We talk about breastfeeding. So you address the A to Z aspect of the pregnancy and postpartum there. So that's how we go about it. So then she completes and she says, I think I also need your support during labor. Then she signs up for the doula part also. So when she signs up for the doula service, I am available for the mother from 36 weeks of completion until she gives birth 24/7. So whenever she calls, I'm there to answer. And I go to the hospital when she's laboring and giving birth. So I support her throughout. And even after the baby is born, I support her during the golden hour for breastfeeding, to settle herself and everything. And in the first month of postpartum, I'm also available via calls and messages for her queries, doubts. If it's an emergency, then of course they have to go to the doctor. But any non-urgent queries, I'm there to support her. So that's one part. One more aspect is BCST sessions, that is biodynamic craniosacral therapy sessions, that they can take throughout the pregnancy. It helps the mama calm down. It helps her attune with the body. It helps her bond with the baby, and it cuts the unwanted thoughts that might be there. It offers that safe space for her to, process layers that she has accumulated, all these things without much of talking. So we can also say BCST is a therapy that does not involve much talking.
Okay. You start with talking and then we are like treating with silence kind of thing, right? So you did mention about informed choice. How do you equip a woman to say yes or no to an epidural or an induction of labor or delayed cord clamping or even cesarean sections with clarity?
So when we say informed choice, we talk about all these aspects and give her the evidence in an unbiased manner. What is the positive? What is the negative? In what kind of situations might a doctor recommend all these procedures? So these...
You're not giving the options when she's in labor. You were actually... See, that is a very important aspect. Most of the time, you make the decision when you're already in pain, right? And distress, literally, I should tell, right? So when somebody is more informed earlier, it gives them more... clarity, or at least make them feel empowered in a way, right?
So when the mother and the father has the information beforehand, they're able to talk to their, care provider about their preferences and also work as a team on what they want. Of course, things can take a turn during labor, but the doctor and the whole team is aware about the preferences and, there's respectful care at place. So that's very important. For any mother, for that matter, it's not about the end outcome that I emphasize on. Has she been informed? Is there respectful care involved? Did she feel safe in the birthing journey? That's the priority. It's not about whether it's a vaginal birth, natural birth, C-section, VBAC. No. How was the journey? That's the matter. That's the goal.
Great. What are the current market rates for, the childbirth classes and hiring a doula? So just what is the range of, services being offered in the current scenario today?
In metros for a doula, I think on an average 20 to 25K. Okay. So, and doulas don't take up a lot of clients. It's just maybe 2 to 3 in a month because she needs to be available 24/7 on call once the mama completes 36 weeks, and she needs to go to the hospital when the mother's laboring. So we can't go anywhere around, different places. So she needs to be present. So it's just 2 to 3 mothers max that they can cater to.
So for the childbirth class?
Birth classes, it depends on the capacity of the birth educator. What are her qualifications? What is the class size? What is her experience? And all these things will determine. So birth classes, roughly for, 7 classes, they might charge anywhere between 5,000 to even 70,000 for it.
70?
Yeah.
Okay. Fine. So what role does a father play during birth and breastfeeding?
He is the pillar of support for the mama. Okay. So when it comes to birth, he is the one who's standing beside the mama when she's laboring. And a lot of times, the mother might not be in a position to advocate for herself. So it's the role of the birthing partner to actually, stand up for the women and say, these things are aligned with this. These things are something that we do not want. And more than that, when you have a partner who happens to be the father of your child, look at you, talk to you, say that you've got this, you're doing good, super apandra, you've got this. That oxytocin surge that the mama experiences is entirely different and it can never be replicated by any other system.
Agreed, because this oxytocin is the hormone which actually causes the uterine contractions as well. So, which is very important in the process of labor. So,
she needs her man.
beside.
Yeah, of course.
So
Be it in
men
the
have
pregnancy, birth,
there are men
breastfeeding.
some men who are hesitant to, accompany during their, it is a mother or mother-in-law usually they try to accompany, right? It's a women's business. So, no, we don't want to come inside, let them handle it. But I know many doctors do that. Like, no, I don't want to come inside. But now the trend is changing. But when we delivered and all, it was not like that. So,
That's when the role of a birth educator comes into play. So when I take classes, I tell the mothers they can sit along with their husbands. In fact, I, advise them or cheer them to bring their partners along. So when they sit for the classes, they have a good amount of understanding about what they're signing up for.
correct.
So they're not scared. And they understand how much the mother has to be invested in this whole pregnancy, birth and breastfeeding journey. And the level of respect just goes up. It skyrockets. So when that's love
and the relationship also, they bond better because these men understand how, the women goes through and they take an active role, right? Else,
90-95% of my fathers are like hands-on. Apart from directly breastfeeding, they do everything for their babies. And even for their wives.
Nice. It's a very nice shift we see in the society as such. Very interesting. Can you give us one breathing technique which is very effective even for a woman who doesn't want to deliver? So
I fondly call this the balloon breathing.
Okay.
So Dr. D, what I would like you to do is keep your hands on the belly.
Okay.
Just close your eyes. Relax yourself. Think of a balloon. As you inflate the balloon, you know that the balloon is filled with air and expands. Similarly, as you inhale, I want the air to fill your belly and let the belly expand. Can we start? Inhale. Let the belly be expanding with all the air that you inhaled. And exhale. Let it deflate and go back to its original self. Inhale is for expansion. Exhale. Let it go back to itself. Yeah?
So you don't, you inhale and exhale through your nostrils only? Yeah. Okay.
You can do it with your nostril, or the inhalation can be with the nostril and exhalation can be with the mouth slightly open. Say it goes like.
Nice.
So you do it as slowly and deeply as possible. So your belly is filled with air with the inhalation, and as you exhale, it goes back to its normal self. So this is the balloon breathing. Easy to remember.
Can you tell me your opinion and importance of Kegel's exercise?
Pelvic floor is something that Indian women do not pay attention to.
Absolutely.
I'm telling you, in pregnancy, in birth, in postpartum, this whole bunch of muscles, hold on to a lot of things, and it needs special attention. So Kegels really help your pelvic floor integrity to be maintained. It's not too taut, not too laxed.
Correct.
Yeah. So definitely Kegels should be something that you regularly do. Along with this, I would also ask every mother to go to a physio, get their muscles evaluated and get custom exercises, because certain people have desk jobs, it's too tight. Certain mamas who've gone through previous birth experiences, it's too lax. So you need something that is customized as per your individual needs. If the pelvic floor is not attended to, it can actually, be a hurdle in the birthing journey as well. Because we need the muscles to do that proper squeezing and relaxing.
Correct. The rotation, with the mechanism of labor where the head descends, rotates, it is being facilitated by the tone of the pelvic floor muscles, which forms a hammock, right?
So we see the baby's head deflects and all those things, and one reason could be because the pelvic floor's integrity also.
Correct.
So when the tone is good, baby's position and descent and birth journey is better.
Better, yeah. So the duration of labor is again not prolonged, and so many things.
And also the postpartum period, the incontinence.
Very true, very true.
Fecal incontinence, urinary incontinence, even the intercourse.
It becomes
very different.
Yeah, very true. And the need for episiotomy also, there are births when in certain institutes where episiotomy is an indication, not necessarily given for all mothers. So if your pelvic floor is well trained and stuff, sometimes it can just end up with only a first degree or second degree tear. So this pelvic floor strengthening is something which is overlooked by Indian women, which even I've always realized. And it's not just in the short term, even in the long term, apart from incontinence and this pelvic organ prolapse, where there is a bladder descent or the rectocelosis, or what we call, is also very high, because this is not catered to. The pelvic floor is not strengthened during pregnancy, post-delivery, and it is not, we don't stop only at that. Later also, as we age, the muscle tone again decreases. And women who have gone through birth, they need the emphasis on this pelvic floor strengthening. Else, when they are hitting their perimenopause time, what happens? Natural for the organs to sag down and come down. So it actually prevents that. So as you said, even the quality of intercourse, which if you have a tight or well-toned pelvic muscles, you enjoy an orgasm better.
Yeah.
Right?
And one more thing, we have a lot of women saying, I want low intervention and natural births. So for all of them, I always say, you need to pay attention to your diet. You need customized exercise plan. Without this, there's no point in talking about low intervention.
And customize the diet plan as well, because I see a lot of gestational diabetes so common now. Being an Indian person itself, you are in the high risk category. An Indian woman, you're pregnant. Previously, it was like if you're a high risk person, you are supposed to get screened. Now, being an Indian ethnicity, from the Indian ethnicity, you are a high risk and you have to be screened. So a personalized nutrition plan will be very helpful. As you said, with the consultation, have a plan for your physiotherapy also, which is again very vital during your pregnancy journey, labor, and even much later. You're a certified lactation counselor. In your journey, how often you see the tongue ties in the infants?
So,
and what do you do about it?
Yeah. So when I see tongue tie, I just wait. I do not rush into intervention, because certain babies can feed well with ties also. Okay, my babies, they themselves had ties. So, but the breastfeeding journey was not hindered because of the tie. So I just wait. I correct the position. I see the mother maybe after a month to understand whether there's any issue with the weight gain of the baby, whether the mother is facing excruciating pain. And then I also look for other indications like, mouth breathing, and baby just, aligned to just one side for sleeping. Baby needs to be on the breast, sucking to sleep, all those things. So there are a lot of other indications that we take into account. And if there are indications like that, then I recommend body work. So I teach the mamas massages. So with massages and with skin to skin contact, there's a level of resolution that certain babies achieve. It also depends on what kind of birth experience they had. Because of that, they can have certain tightnesses also involved. So I look for the massages, and I teach them the massages, and I look for the resolution to happen. So if even after that there are challenges, then I go with my biodynamic craniosacral therapy work. It beautifully works for babies, and with that, I think a lot of babies get benefited, and the breastfeeding is very, very better. And despite all these things, if the tightness persists, there is poor weight gain, the baby is crying uncontrollably always, the baby needs to be on the breast 24/7, the mother has excruciating pain, then we refer them to a professional, a doctor. A proper evaluation is done. The pros and cons of, doing a tie release is discussed, and then they make a choice.
Okay.
So assessment followed by general body massages, followed by BCST, then referral. That's how we go about it. So we don't directly
go into a surgical procedure or something. What are the top 3 myths about breastfeeding you wish every Indian family unlearned?
Wish I could go for an entire episode about this, but I'm just going to limit myself. The first one, you don't need to squirt and leak to prove your milk supply. Because every auntie of yours, once you give birth, the first thing they would come and do is, pinch, squeeze to see the milk. It's not like, by the flip of the switch, the light flickers. Baby sucking is what will tell your body to have, let the letdown happen, milk flow in. So squirting and, heaviness, all these things are not indicators to say that you are making a lot of milk. Okay.
Enough milk even.
Enough milk even for that matter. Yeah. And then the next one is, asking the mothers to consume huge quantity of food, saying that is when you will produce milk. Only if you eat this much, you will have this much amount of milk. Again, which is completely false. I would always talk about the quality of food rather than the quantity, because your blood...
See, people need only 300 extra calories, for a normal weight person to, aid in the lactation as a. So the 300 kilocalories can be quality nutrition, which can be added to their regular diet. Not necessarily you need to eat again double. Like, as they say in pregnancy, you don't have to eat double. The same way, even again during lactation also, you don't have to eat double. But just you have to make it nutritionally dense. Right?
I say the mamas always to keep munching every 2 hours once something that is healthy. It can be fruits. It can be a sprout salad or something like that. So it keeps her sort of, full, and she does not need to really hog on the carbs. That's something that I always say. And one tip that I would say for all the mothers is to keep a water bottle beside their bedside.
Hydration is very important.
Yeah. So when this is done, they don't, tend to overeat and struggle with, weight issues in the future.
Absolutely. Because in my own personal journey also, I think I gained more weight during lactation than my pregnancy. So, because your sleep is also again disturbed, right? So, it's the pattern of eating, sleeping, everything is so messed up, which you're not trained and prepared for. Despite me, I had my first pregnancy after I finished my MD. So, despite that, I was not really prepared for the breastfeeding part of the journey. Honestly, with so much medical knowledge, still I was not prepared. Oh, it will be so sleepless. And for the first pregnancy, this was a challenge for me even. So,
and breastfeeding is not hereditary. People quote examples saying that, I didn't have milk. Your aunt didn't have milk. So it's been hereditary. So you might also not have milk. You have to supplement. Supplementation is the one that actually hinders the milk supply. When you tend to supplement, the baby sucking on the breast reduces.
Supplement for the baby. That means a formula feed for the baby.
Yeah. When the baby sucking and draining on the breast reduces, the supply automatically takes a hit. The more baby sucks and drains the breast, the more you're going to produce.
Absolutely. It is like a supply. It's a demand supply instruction. That is what is happening. No?
Yeah.
If the baby takes a formula feed, all the powders what we get commercially, if the baby takes it, it is very filling. So the frequency with which the baby goes again suckles is reduced actually. So the more frequently the baby, it's like an on-demand supply, right? It is together you establish the quantity and establish the rhythm. Right, great. So what are the pressures Indian women face from mother-in-laws, extended family, social media that directly interfere with confident breastfeeding?
I wish things would change, but
we're doing the podcast for that.
Yeah, the obsession towards chubby babies.
Yeah,
people associate health with weight in the infant stage, not during the adult stage. I'm telling you, that's when we want everyone to be sleek and slim. But when it's an infant, they want chubby babies. They say only if the baby is chubby, the baby is healthy. So the weight obsession is actually, putting the mother in a very, very tough spot, and where she has to choose overfeeding the child or supplementing the child with, powder milk, etc. So that's something that's very huge. And here now in the market, breastfeeding also comes with additional assistance like pump. Earlier it wasn't like this. Now even when people come to classes, they're like, should we get pump for the hospital bag? I'm like, why? Yes, I am not against pumping and feeding, but that should be something that you make as a choice, not because things are being, advertised to you in such a way, saying that breastfeeding will happen seamlessly and your supply will be maintained only if you pump. That's not the idea.
Correct. So because everybody, they also want to, buy one breast pump at home and keep one. That is very common thing which I'm seeing these days. It's not needed, and as you say, the hospital grade ones, because it is more effective in a way. So people, and maybe they want to get more sleep. Is it because of that? Maybe they want to skip a feed where they put directly the baby into the breast, or is it, what is the ideology behind?
The idea is that they think that pumping is the one to help keep up the milk supply.
Okay.
So, and I tell you, with my experience as a lactation counselor, many people end up having oversupply, engorgement, mastitis because of overpumping also.
Correct.
In the initial days. So it's a tricky balance which needs professional guidance for you to make the right decision. And it's very, very customized, case specific.
If the baby doesn't require and you kind of promote that much oversupply, then you end up in breast engorgement, mastitis, and unnecessary infection and all that. What is your take on, if my mother's milk is less, there are many lactational supplements for the mothers to improve breast milk. We call them as galactogogues. So the natural galactogogues and the commercially available galactogogues. What is your take? When should a woman prefer it?
So with respect to the galactogogues, generally what we do is with the lactation consultation, we talk about, a good overall diet, saying that it will help you in the breastfeeding journey. We don't talk about saying that this is going to help you with the supply, increase the supply. But as an overall good diet, we offer something. And families, they go to the doctors, ask the doctors for it, and they get a prescription, done. So with that situations, I let the mothers complete it, because even if it's going to be a placebo, it's okay. If the mother is going to feel confident because she's popping a pill, it's okay for the initial days. So as a lactation counselor, when I step in, I see that she's, consuming tablets for that. I don't tell her to stop it then and there. What I do is I work with her on the latching, on effective draining, etc. And I ask her to complete the course of medicines, and after which I ask her to make the switch. So by then, she's had consultations with me. She understands the nuances of breastfeeding and she's confident. Then we wean off the tablets.
Okay. What are the foods a woman can take to naturally promote or increase breast milk?
I wouldn't really call it increasing, but what diet I would generally say is that cumin, asafoetida, ajwain, ginger garlic, fenugreek, oats, bottle gourd, and a special rice called poongar. This is something that you usually give for a breastfeeding mother.
Yes. So what is the most unusual but effective thing you've done to help a baby latch and a mother relax?
Sending people outside.
I know.
There is this pressure. So many people looking at you. How is the mother going to ease? And the babies are attuned with the mother's system. So I will send everybody out. I will just have 1 or 2 people who are really going to help the mother stay calm and support her in the journey. So there is no room full of spectators when I go for a consultation. Everybody out.
Everybody out. Nice. Makes sense. How do you see technology helping or harming birth and breastfeeding in the next 10 years?
Again, it's a very, very tricky one. See, the technology is offering us so many information, and I think sometimes it's leading to overload. The mothers are overwhelmed as to what decision
This
they would
is
like
all
to
the
make.
doctors also usually face, right? They've Googled enough now.
Too
ChatGPT is
much.
also there. So with all the other AI tools coming and everything, so they are loaded with a lot of information. One. But apart from that, there are many variables coming. So many technological changes are. So how do you see the shift affecting, helping or harming? So
One way I see technology helping is the right access to the right professionals.
correct.
So that is something that I think with the help of technology, the mothers are able to reach out to the right professional. Given like 10, 15 years before, do you think a mother would have been aware about
I would not
a lactation
known that
counselor,
this person
birth
exists even
educated,
today.
yeah.
Yeah. So that is a very important
Yeah.
harmful effects. What do you-
overconsumption,
Correct.
overthinking,
Ah,
leading to stress,
yes.
leading to feeling underconfident.
Correct. It's good to have knowledge to make informed decisions, but when you consume more, then what happens? You have a pattern of fear, and you start thinking of all the possible complications that you might encounter, which is unnecessary, and you confuse it. And again,
also hoarding stuff to think that you're doing what is currently needed to be the good mother or good father.
the pressure to be right.
The pressure to perform, meet
Yeah.
the standards that's set by the consumer world.
I know. Very true. Very true. Sometimes I also question, so do we really need so many products that's just available in the market? So many, right? The baby, if I ask my pediatrician friends, they say only a coconut oil massage is good enough for a baby. But, we have moisturizers, we have so many creams, so many things, fragranted ones, for the baby, so many products for the baby, which is actually not needed, right? That is an industry which is trying to make a business, but is it really needed for your baby? Really not, maybe. So this is something which we have access to. So many things we see, okay, we might have to invest here and spend our money unnecessarily. I would even suggest, like, rather than invest in all those products, invest in the right class and learn properly, and or spend that money for a doula, or spend to an expert gynecologist, where you really kind of put the money, trust the person whom you have chosen, and stick with it without breaking your brains too much. With all that is flooded in the market, we really don't need so many things. Now it's like one shopping for this baby is like one big cart load people are buying.
It's not even thousands, it's lakhs.
Yeah, it's not even necessary. See, the idea is this all I need to buy, else they feel that fear of missing out. And I think that is something what technology is actually creating. So both boon and bane in a way.
What I said, tell mothers and fathers is that your baby does not have a rule book with a checklist saying that you need to tick all these boxes. Raising children is simple. When I say simple, you don't need materialistic things to raise a child. The child needs, floor, grass, water, some cutlery while playing,
your presence, your company.
Yeah. Your presence, your touch, your kisses. All these things are non-negotiable.
True.
The true presence of the mother and the father without the obstruction of gadgets is what is going to help them raise the child.
Correct. Absolutely. So now I'm going to go to the concluding, but my favorite part of Feminine Systems podcast is the rapid fire. So you can choose to answer it in one word, one line. Sometimes, though it's called rapid fire, you can give an explanation. So describe childbirth in one word.
Holistic.
One ritual you recommend during third trimester.
Massage.
Any specific?
By the partner.
By the partner. Okay. Yeah. So even I was always thinking this perineal massages are something which people are not aware, which actually helps a lot, right? It facilitates normal birth a lot.
Yeah.
So
that's something that I would always ask them to definitely talk to the doctor and start. Really helps.
Really helps. Even I've seen that very effective actually, which many people don't do. Prevalence of postpartum depression is almost 20% in India. True or false?
I would say false, because there are a lot of things which are unaccounted also. So I would say it is more.
Okay. So what is reported is maybe 20%. It's more.
Yeah.
So 1 in 5 women may suffer from a postpartum depression. It's very, very common. As a family, you should be aware. And
we're always silent, saying that this is normal.
Correct.
Why are you, feeling sad about it? We're all here. It's just gonna pass.
Many relationships break there.
Yeah.
I'm telling you, there is a lot of a disconnect that happens because of the behavior, which is sometimes they feel totally, because all the estrogen, progesterone, there's a withdrawal of them. The feel-good hormones are gone. One thing, right? And the mother is tired, sleepless, no proper recovery, rest, rehabilitation is there. So it's a very important and ignored phase, I would say.
The entire ecosystem works around the child and
they
not for
forget the mother.
But what they don't understand is that they need to support the mother for her to raise the child.
Absolutely. The mother is being pampered during pregnancy, and once the child is born, she is literally ignored. You over pamper her, and suddenly again another withdrawal, which is something very, very concerning for me. I always think, when the child is born, this is not even a person. Ideally, the requirement of your nutrition, like your calcium, iron, is also high during lactation, the postpartum period, and slightly the calorie intake, when it's only 150 to 200 calories during pregnancy, it's 300. So, and the attention and support is ideally most needed at a postpartum phase, which is more ignored, right? So,
when there's a baby, all that people see is happiness. But there's a myriad of emotions that the mother goes through. There's not even 10% of acknowledgement.
No, they identify with the baby rather than this person who's been with us for the past 20-30 years, right? Like this is the babies, they just think that is a lineage, and the kind of identification with the baby is more. Postpartum confinement centers are on the rise, which was practiced more in Kerala. Now we see that globally. Is it a boon or bane for Indian women?
I think it's a boon, definitely, because I would say the first 48 days is very, very crucial for the mother to rest, recoup, bond with the baby, get the confidence to breastfeed. And that's the period where we are flooded with relatives and all unwanted advices. The mother as such is sleepless because of the breastfeeding, burping, and cleaning journey. And to top it off, we have people always 24/7 visitors. So mother is completely tired and worn out.
Sometimes you're very cruel to that mother at that phase, right? When she actually needs that rest, that 6 weeks postpartum is very crucial for them to rest, rehabilitate, and get back to. It's very important for them to even bond. It's mostly a very nightmarish experience most of the time. If you ask a woman who's gone through it, I think pregnancy would have been a jolly ride if there was no vomiting and all that. But otherwise, this postpartum is something which they're not prepared for, clueless, and are very less supported by.
Yeah.
Right?
Yeah.
So,
and for us to tailor it culturally, that's also one thing which I would really emphasize on.
Interesting. Your favorite labor affirmation?
You know yourself better.
Nice. Very nice. Your favorite baby shower ritual?
Where people come in collectively to bless the baby and the mother with, the sandalwood paste or the bangles. It's like the whole universe is showering you with all the blessings and abundance for the, life to be, born.
Nice. It was nice that those glass bangles were all used. Rightly they do the for the baby.
Vibe, the positive vibe that you attract during the bangle ceremony.
Yeah,
that's a different level.
Incredible, actually. In those days, it has been. I also like the that 5 variety rice, which actually there is scientific evidence which says if the mother is exposed to different tastes, right? You stimulate your different taste buds, like different tastes like bitter, sweet, sour, all those taste sensations are stimulated. The baby also learns to actually prefer to eat foods with diversity.
What I tell all the mothers is that don't be picky. Try to eat everything. If you don't want a child to do what you've been doing now,
correct,
then you need to have something wholesome.
Correct. There is only one position to labor? Yes or no?
No. There is no one position that will suit all the mothers. I might feel comfortable standing and doing it. Some others might want to squat. Some others want to get on all fours. Everything is okay.
Absolutely. Many people, apart from the standard lithotomy position, they really are not aware of the other labor positions.
I always say this example where we, put the pillow in the pillowcase. We don't do it horizontally. What we do it? We insert and we do the jiggle wiggle.
Correct.
So the gravity aiding position is very, very helpful for the labor to progress, for the baby to descend and for the birth to happen. We expect the mamas to lie horizontally on the bed, full length of labor, and then we want the baby to be in optimal position, crown and come out.
Correct. Water birth.
Yeah.
Boon or bane?
Boon.
Here we do
hydrotherapy or water birth.
Here we do hardly any centers in Coimbatore offer it.
1 or 2 centers, yes.
So, water birth?
Yes.
Yeah.
One is hydrotherapy, the other one is water birth.
Okay. So, thank you so much, Haritha. It was a very beautiful discussion, I would say, for a very meaningful phase for a woman where she goes through maternity and delivers a newborn baby. So, I'm very glad and happy to have you on a podcast, Feminine Series. Thank you so much.
Thank you for having me here. It was, such a beautiful conversation to have this 360-degree approach towards birthing, especially with OBGYN.
Okay, so
Thank you so much.